Good day, and welcome to this lesson on renal and fluid electrolyte clinical pathophysiology. In the previous session, we saw that asthma is a reversible airflow obstruction caused by airway inflammation and bronchoconstriction, and chronic obstructive pulmonary disease is a chronic progressive airflow obstruction with air trapping. We also saw that pneumonia is a gas exchange disorder, where alveoli fill with fluid or inflammatory material. And pulmonary embolism is a perfusion problem caused by blockage of pulmonary blood vessels. By the end of this lesson, you will be able to describe how the kidneys regulate fluid balance and electrolytes, differentiate using clinical signs, dehydration, fluid overload, and shock-related kidney injury. Let's start the lesson by asking, what do the kidneys regulate? The kidneys are the body's primary internal balance organs. They continuously filter blood and decide what stays in circulation and what leaves as urine. Their work determines whether the heart, lungs, brain, and muscles function normally. They regulate four major systems. These regulation includes fluid balance. The kidneys control how much water stays in the bloodstream. Too little fluid reduces organ perfusion. Too much fluid overloads circulation and stresses the lungs and heart. Electrolyte balance. They keep sodium, potassium, and calcium within safe ranges. Even small shifts can destabilize vulnerable patients. Another system the kidney regulate is acid-base balance. They stabilize blood pH by excreting hydrogen ions and regulating bicarbonate. Without this control, metabolic acidosis develops, which affects cardiovascular and respiratory function. The last system is waste removal. They clear metabolic waste products that must not accumulate. Please note, kidneys depend heavily on blood flow. When perfusion drops, kidney function often deteriorates early. At first, this deterioration may appear silent, but quickly spreads systemically, affecting cardiac rhythm. By rising potassium levels, fluid may build up in the lungs, and reduced brain perfusion can lead to confusion. Now, how does the kidney control volume and perfusion? The kidneys protect circulation by adjusting urine output. Fluid control is not just about water, it is about perfusion and organ stability. When volume is low, this is dehydration or reduced intake or perfusion. The kidneys conserve water, reduce urine output, and attempt to protect blood pressure and organ perfusion. This is a compensatory response. However, prolonged low perfusion can reduce filtration and lead to acute kidney injury. When volume is high, this is when fluid overload. The kidneys should excrete excess fluid. If they cannot, or if excess fluid is given, fluid accumulates. This leads to edema, pulmonary edema, and increased workload on the heart and lungs. Let's look at dehydration, fluid overload, and shock. These conditions may look similar clinically, but the mechanism differs. In dehydration, circulating blood volume is reduced, leading to decreased kidney perfusion and an increased risk of acute kidney injury. In fluid overload, excess retained fluid causes congestion, and this can lead to pulmonary complications. In shock-related kidney injury, systemic perfusion fails, causing inadequate blood flow to the kidneys. As a result, Acute kidney injury develops as part of widespread organ deterioration. In summary, we talked about the 4 major kidney system regulation. These regulations include fluid balance, electrolyte balance, acid-base balance, and waste removal. That is all for now. We shall continue the lesson in the next video. Thanks for watching. See you in the next lesson.